tourist alpacas were visiting the local nursing home. So we jumped on that unique bandwagon and invited them along to come see our patients and family and staff at Borders at hospital. So we thought this was a very unique thing for Borders to have. As therapy animals, it's uplifting, it's benefits to health for our patients. So what's a real treat for us is when we see the patients' faces, the children's faces that are our inpatients, when the alpacas arrive, and to come and say hello to them. And that just really is uplifting for all of us.
Oh my goodness, you are holding Ed Sheeran.
The most beautiful animal I've ever seen in my whole life. I loved it very much, and the hair and soft. Up in heaven. It's beautiful.
We run Mountfield Alpaca Farm over at Canungra. We copped it hard during Cyclone Debbie. The community gave us a fair bit of support, so we thought this was a good opportunity to give a little bit back. Take the guys into to see the patients. It's great to go in there and see the look on people's faces when they see them.
Oh, he's cool.
Oh, listen to me.
I've never seen one inside a hospital.
Not sure. So he's expecting to hear someone in the back.
Totally inappropriate. It has a harness on the alpaca which is uncomfortable for the animal. It is not a natural environment where it can't feed, and it's being groped by people who don't relate to alpacas. They call it Ed Sheeran and Tim Tam and Pancake. And Michael Cleary thinks that that's funny, no doubt. I don't. What else do they have? Well done to Metro South Health, who have been recognized as world leaders in healthcare after receiving 3 International Hospital Foundation awards. Michael Cleary likes that, of course. Administrators packing themselves on the back for vulnerable communities, looking after vulnerable communities. So Michael Cleary, look at the computers. It looks like a spy outfit. That's what it is. A solar tent for the homeless. So he posts, "Stop the suicides of our hard-working doctors. It's time to stop the pain, suffering, and suicides of our hard-working doctors." Well, if these hard-working doctors stop throwing around around disease labels, they wouldn't be diagnosing themselves with them. Yeah. So that's how administrators spend their day, administering on LinkedIn and building their profile. Michael Cleary has many more LinkedIn postings. He's quite active on LinkedIn. Let me check the date. Today is the 18th of December. My computer is taking a while to load. It's the 18th of December. A week before Christmas. And if I don't turn up for an injection today, they'll send the police around and lock me up for Christmas. So I'm still waiting for Nigel Lewin to call me back. While Nigel rang me at 8:30 this morning and said he didn't have time to talk to me, but that he would call me back after he had finished a meeting that he was at. So I called back, and they said that he was with a patient. An hour later I called back again, and they said he had gone out. So I've been doing a bit of research into the PA Hospital's leadership, the directors. Michael Cleary. It looks like him there. Meetings between the executives, the commissioner, knowledge exchange program in China. Goodness me. The Shanghai Municipal Health Commission and the Director General and executives from Queensland Health. This provided an opportunity to discuss potential sister hospital arrangements and to discuss opportunities to work together in areas such as education and training, capability development, and research projects. Day 4 and 5 of a knowledge exchange program in China. Well, I don't think Michael Cleary has a great deal of knowledge. And I went to medical school with this guy. So he is the Vice President of the Queensland AMA, the Australian Medical Association, the Doctors' Union. Day 3. This is 3 months ago. He was one of my contacts on LinkedIn, but he disconnected the connection, and I was still connected with Stephen Eyre, and I sent Stephen Eyre some my statement of claim against the PA Hospital, and he's disconnected me as a connection as well. So this is the leadership of the PA hospital. And I think they have a case to answer, apart from the fact that they're the most awful nerds. They really are a nerdy bunch, these administrators. They're innocuous, seemingly, but they oversee a terrible series of atrocities. Their clinic, the Woolloongabba Mental Health Centre, the Woolloongabba Community Health Centre. They've changed mental to community. The Woolloongabba Community Health Centre has the PA Hospital's outpatient clinic, and all they do there is write out scripts for patients and inject them with long-acting injectables or depot. That's all they do there. They say that they do psychological therapies. They don't do any psychological therapies. And each of these injections costs hundreds of dollars. That's why they can't afford to do music. There's no music playing in the community health center. There's no facility for art. There's no counseling. And the decor is sterile and ugly. They don't have anything to teach China.